Hey folks, I just wanted to check in for my second video, and today I wanted to talk about a topic that I think is pretty important, and a lot of women that I see, whether it be for you know perimenopausal issues or menopausal issues, or even women in their 20s and 30s, it seems that hormonal imbalance is very prominent in our society today, and probably the number one imbalance that we see is estrogen dominance. So what is estrogen dominance? Well, that can be where simply your estrogen is just way too high. And there's a difference between an estrogen dominant state and a progesterone deficient state, in the sense that sometimes you can have normal progesterone, but you have an estrogen level that's just simply too high for that progesterone level. So I'm sure many of you are familiar with the symptoms of estrogen dominance, from breast tenderness to breast cancer, fatigue, fibrocystic breast, foggy thinking, gallbladder disease, insomnia, irritability, memory loss, mood swings, hypoglycemia. There's all kinds of autoimmune issues that can happen with it, and realistically, it's something that can cause even problems in men. I don't see that, but too high of an estrogen in a man can cause issues with the prostate. In women, it can cause uterine cancer, mood disorders, premenstrual syndrome. So the reality is, we want to be able to get your estrogen dominance into control. And what are some estrogen dominant problems? Why do we have it? Well, there's either exogenous estrogens, which are the kind that you're taking orally, and those can be from birth control pills to hormone replacement therapy to things that you eat, whether it's the estrogen in the foods that we eat, like beef, or even water tainted xenoestrogens from plastics and things of that nature, or if you're having an endogenous estrogen issue because you're making too much estrogen from your own fat cells, or your hypothalamic pituitary axis, your brain talking to your ovaries, talking to your uterus, and that feedback loop just isn't working properly. So the ovaries are making too much estrogen and they're just not making enough progesterone. So what can we do about it? Well, women that have migraines or things of that nature, where you're having issues with headaches, sometimes get adding progesterone back. So sometimes we go to medications, we go to progesterone, we go to things that can lower the estrogen level. But let's say we're going to balance the estrogen to progesterone ratio. I usually like to see the estrogen to progesterone ratio be about 10 to 1. So in estrogen dominant women, I will offer progesterone, and that can be topical, it can be oral. Usually topical is a good approach, but some women prefer to take the oral medication, and we just use enough to help women either with insomnia or headaches or vaginal bleeding. Usually this is done prescriptively with a physician who knows how to prescribe bioidentical hormones. You can use over-the-counter type creams like ONA's, O-N-A, and ONA makes her own progesterone creams, or as she calls them, skin creams, out of California. And if you want to learn more about those type of over-the-counter therapies, you can go to the Facebook page that I posted on my my Facebook page. It's called Estrogen Dominance, and Kitty Martrone is in that group. She's very knowledgeable about those type of things, and she can help you immensely, or at least guide you in which area to go to find those. There are some supplements like DIM. DIM is a supplement that you can buy at the store that will help lower your estrogen ratio to lower your estrogen to progesterone ratio. It's not always effective, as some supplements aren't, but many times it can help. I have found that maca is a very good supplement if you use the right type of maca, like the type that's found in Feminescence. That is, you can email me about that, or you can find it at your local CVS. Kim Sanders, hey doc, has it been proven that early hysterectomy is linked to fibromyalgia? I don't think that fibromyalgia, at least I've known about it for years. My mother, had it. I've seen patients, obviously, that have it. I don't know if we know what causes it yet. Maybe a hormonal type imbalance, especially if you had the ovaries removed, can be a trigger for that. It's hard to say. but I don't suppose that it probably helps if you have an issue with fibromyalgia to also feel horribly uncomfortable because you have a hormonal imbalance at the same time. So I would say it probably adds to the effects. So estrogen dominance, hormonally imbalanced women, it's probably the number one thing that I see. It's fairly easily fixed, although sometimes it takes a lot of different aspects, and there are a lot of women, especially Kitty on the estrogen dominant side, will talk about um, liver flushes with even coffee enemas. I have yet to try that yet myself, obviously, but it's worth a shot. There are some other hormonal healthy alternatives. Is another website on Facebook here that you can learn a lot of information from. Maria Claps runs that page, and she can answer a lot of questions about getting your hormones tested, especially if you don't live by me and you can't come to the office. But if you did want to come by, or you live in the area or Texas and you want to swing by, you can call my nurse Amber at 512-533-4141, and she'll get you in for an appointment. Otherwise, feel free to drop questions on the Facebook page. I'll try to answer them as best I can, and be on the lookout for more stuff in the future. Thanks, and have a good lunch.